I want to first talk about, where we were and where we are now. The numbers fell because of the actions the people in Alabama took. When you look at it, 2, 3, 4 weeks ago, our house in Alabama was on fire. If you look at these posters here, you've seen the 20% growth model that I had out there. And we were on track for many days in Alabama, consecutive days, where we were 20, 30%. If you look at that, if you have 20% growth for 30 days, it's 262,000 cases that would occur. If you have 15% growth for 30 days, it's 72,000. 10% growth is 19,000, and 5% growth is 4,600. That's the difference in exponential growth versus linear growth. And what I want you to look at now is these are current cases. If you look back in March, percentage of growth, we were in the 30% growth, some days in the 50s, then in the 20s. The encouraging news is this. The last day of 21% growth was on April 3rd. Since then, we've been in single digits, and 6 of the last 7 days, yesterday was 4% growth. It's not on here. We had to get this made. The encouraging thing is what we've seen in the last few days, and I would say over the last, really since April 3rd, and even before that, that's linear growth. It's not exponential. Exponential growth is what we were worried about and what we saw early on. I want to thank Governor Ivey for her leadership and what she did to stop the exponential growth in Alabama. I want to thank Dr. Harris. He's a good man. We're fortunate to have him in Alabama. And because of his recommendations and his leadership, we're in a spot now, in my opinion, where we can reopen and get our economy going again. We're very fortunate to have him. I want to say this. When you look at, as far as reopening the economy, how do we do that? First, we're going to need Dr. Harris's help. We're going to need Governor Ivey's help. We're going to need the medical community's help. But I want to look at the situation from a standpoint of a business owner right now. The SBA program, the PPP, is out of money. Literally, there's people sending us messages, people that were on our committee, where they could not get money right now, and it ran out. The number of unemployment claims in this state is staggering and at an all-time high. More than 300,000 claims have been filed in the last 30 days. To give you a reference, 130,000 claims were filed in 2019. And so, obviously, this virus is deadly, it's dangerous, but our committee believes there's a way to safely reopen the Alabama economy and get people working responsibly. So I want to talk about our recommendations in just a minute. Before I do that, I want to talk about how this was created. Our subcommittee was tasked with Governor Ivey for safely reopening businesses, restoring commerce, recharging Alabama's economy, while the number one priority is protecting the public health. Small businesses, their owners, and their employees have been hit especially hard by this pandemic. We hear from them every day. But I want to talk about this real quick. It's currently considered safe to go to a box store and buy potentially furniture. It's currently considered safe to go to a box store and buy clothing. It's currently considered safe to go to a box store and even buy jewelry. And our message is simple. The message about social distancing is spreading people out. And the committee says that it's not fair for small businesses to be open and be penalized, and we actually believe that smaller stores mean smaller risk. Why do we say that? We believe that you're spreading people out, and so instead of a lot of people going to one store, now you potentially have, maybe 5 people going in a store to buy clothing. And I think when you look at that from a social distancing standpoint, we believe one of the recommendations we're going to make is in retail, but we believe that smaller stores equal smaller risk. I think, and we'll talk about the restaurants in a minute. I want to say this, when it comes to reopening the economy and putting people back to work, I want everybody in Alabama to understand this. We believe every business is an essential business, and our committee believes that. Each day that our economy stays closed, the ripple effect, goes through our state. So I want to talk about our recommendations that we've sent to the governor. She received them first. I talked to the Governor Ivey this morning. and walked her through the recommendations. First recommendation, that we recommend these businesses can safely reopen immediately, which is we believe these businesses can operate now safely. First is retail. And again, we said smaller stores, smaller risk. I'm not going to go through the whole report. It's 155 plus pages, but I'm going to highlight some things, and you'll be able to get a copy of this. It's on our Lieutenant Governor Page's website. It'll also be on Atlas, Alabama. But I want to talk about this. Retail stores. Our recommendation is they ought to be able to operate the same capacity as the big box stores. All right, that's at 50% capacity. Checkout lines need to be clearly marked, just like in the big box stores, where they're practicing social distancing. Because the fight over this virus is not going to end today. It's going to continue. But we believe we can open these stores safely. Doors and exits will have regular sanitation measures, and there's a lot more. That's just to highlight. Restaurants. We believe smaller groups, again, smaller risk. And we believe there's a way to safely open restaurants with limited capacity and proper spacing in Alabama. Our recommendation is, first, customers will have to be seated 6 feet apart. Second, the groups will be limited to 6 guests per table. And third recommendation, and again, there's multiple recommendations. I'm just highlighting a few here now. You know, we're making sure that all surfaces are sanitized regularly. We believe that in restaurants, you know, that's important. And I also believe, I want to say this, is I'm a husband, I've got a wife, great wife, Kendall, 3 kids. I'll feel perfectly safe going in a restaurant and eating. I probably would wear a mask, just like I did in here when I walked in the restaurant until I sat down at the table. But I want the public in Alabama to know that these recommendations we're making, you know, I also think these are safe. Next thing that we recommend that we think are safe to open immediately from our committee is close contact services. As you can probably tell, maybe you can't, my hair is a little bit long. I need a haircut, right? So our recommendations, close contact services deal with barber shops, hair salons, nail salons, tattoo studios, tanning salons, and waxing salons. These services, you know, I think can be done. If the governor and Dr. Harris decided that this would be something they would open, you know, this afternoon or tomorrow, I'd go tomorrow and get a haircut and feel safely. I would probably wear a mask. Now, we have a lot stricter requirements from our committee on this. First, all employees will be required to wear masks. Second, no customers will be allowed in the waiting areas. And third, customers will be served by appointment only. And again, I want to emphasize, these are not the only recommendations. These are just a few we're highlighting to make sure the public is confident. But I think, you know, certainly these can be open in a way where the public can be safe and we can make sure the disease transmission is minimal and hopefully not at all. Next, our final recommendation for businesses we think can open immediately, and I think this directly ties in with unemployment. It directly ties in with people that are already working in essential businesses as well as these businesses that would be open, is child care facilities. And we are recommending to follow the CDC guidelines, obviously with sanitation, and also the CDC guidelines that recommends 11 children in a child care facility. We think that's important. Next recommendations deal with recommendations that our committee decided need to open on May 1st. The first is medical and health services, medical doctors, oral surgery, dental offices, physical therapy clinics, and one that we accidentally omitted that's getting added to our report that you'll get sent is also optometry. Requirements on them, and this, let me say this, we worked with these associations, we worked with these doctors, and you know, I've got a lot of friends. I've got a friend that's a doctor in Guntersville that, you know, used to seeing a lot of patients. Now the patients are scared to come in. I've got a friend that's a dentist that had a thriving practice right down the road in Guntersville. Literally, no one could come in, and you know, so I talked to them along with everyone else on our committee, talking with their dentists, talking with the associations to find out, do you think it's possible to safely reopen? These people said yes. So then we said, okay, what would it require to do that? Some of the recommendations were N95 mask, gloves, and facial shields worn by all employees. These are for dental, recommendations here that I'm going to go over. I'm not going to go over every single thing in health service. These are dental recommendations. All surfaces be regularly sanitized. And again, no patients will be allowed in the waiting room. If you go to a dentist's office, you'll pull up, you'll wait in your car until it's your time to go to your chair, and they'd obviously notify you to come in then. We think that working with these industries, that obviously doctors, these providers know what's best, and we think a May 1st recommendation is what they recommended. Next, entertainment venues. These are racetracks, casinos, bingo halls, museums, planetariums. This would, first, it would deal with a 35% capacity issue on some of these. Taking temperatures of employees before allowing them in the facility. Maintaining a distance of 6 foot in between each patron. Regularly sanitizing high-touch areas. We think those are important. Exercise facilities, another May 1st recommendation. They already have a sanitation system in place, but it needs to be upgraded, and it's got to be even more thorough now. The spreading of equipment to make sure proper social distancing is going on. Regular sanitizing of equipment and contact services, and limiting the interaction between employees and gym members. Next issue is the beaches. I know a lot of people have heard about that. Our recommendation on that is twofold, and we worked with the leaders in Baldwin County. We worked with the Mayor Kraft. We worked with Mayor Kean. We worked with Sheriff Hoss Mack. Worked with Senator Chris Elliott on getting these measures in place. But let me say this, I think it's important, and I think from my standpoint there's a way to safely do this. So the recommendation is this: May 1st, beaches will be open to recreational activities such as walking, running, fishing. This is a model that they use in Hawaii right now, and it seems to be working well, where people are on the beach, potentially exercising, walking. You have to still practice social distancing, but it allows people to go to the beach. It allows our state to make sure we get the revenue. We think that can be done in a safe manner. On May 15th, if you look at the group over the poster there, it's going to expand. So if my family went to the beach and we stayed in a condo or a house and we actually wanted to go to the beach, then we would be allowed to actually be in a chair, have a tent, but only with our group. And so if you look there, smaller group, smaller risk, the recommendation is going to be 10 or less. And only with people you're staying with, or if you're a resident of Baldwin County or you drive down from the day, people you live with is the recommendation there. So the idea is you'd be on the beach with your group you're staying with, and in my opinion, with my family, with Kendall and my kids, whether I'm in Gunnersville practicing social distancing or whether I'm at the beach practicing social distancing, we still have to stay 6 feet away from any other groups or people when we're in our group. But the recommendation is you're not allowed to have more than 10. That would go into effect May 10th. Now, people ask, how are you going to enforce this? Great question, and something that we worked with. We worked with the mayor, both mayors in the cities, as well as the sheriff, and there's a plan in place to have patrol similar to like what you see, beefed up patrol at spring break, to make sure that people are practicing social distancing. My belief is the people of Alabama, for the most part, are going to follow the guidelines and do what we ask. However, we want to make sure we have patrol there, and we're going to do that. One other thing is we've heard a lot of different issues about sports, different things. There's one recommendation we had dealing with youth baseball and youth softball, and this is a later recommendation. May 11th, it came from some national, several national associations as well as states. There's some that thought you might could do it earlier. There's a lot of stringent requirements, and each league has different things. Some of the things, no public concession stands. All the fans are going to have to practice social distancing. Kids wearing masks when they're in dugouts. Those are some of the things. But I think when you look at our kids and giving them hope, and our national pastime this summer, youth baseball is something that could certainly give us hope, and as well as potentially other sports that can maybe be done safely. But baseball being outside, We think there's a way to safely do that, and there's already a lot of national as well as state organizations that submitted some good plans, and so we submitted that. We also had some industries in our report that recommended best practices. They're already open, but they also wanted some guidance and maybe some recommendations, and so we submitted those as well: pharmacy, real estate, manufacturing industry, and agriculture. And final thing is, you talk about PPE, right? And that's a big issue. One of the most encouraging visits I've had, this last week I got to go to Coleman and tour a plant, and they're looking at producing medical grade face masks right here in Alabama. They could basically produce 300 to 400 million. And so when you look at this, a PPE, one of the things that the governor's been working on, doing a great job with Secretary Canfield, is to try to get manufacturers in Alabama to produce PPE. That's a great example. We're going to continue to push that to make sure that in this new normal, right, we've got to get the economy back going, that we have safeguards in place. So